In this video, we will be showing how to change a low-profile G-tube button. Before we get started, I would like to give you some important information. After your doctor or nurse has given you the okay to change the tube at home yourself, you can do this anywhere, as long as you have all the supplies you need. Your home care supply company will arrange for a spare tube in the home, along with your regular G-tube supplies. Always be sure to have a replacement button tube and supplies on hand for immediate replacement. You never know when your child's G-tube may fall out or need replacing. If your child's tube falls out, don't panic. You have about 1 hour before the G-tube skin starts to close up. Call your doctor or nurse if concerned. The button tubes usually last 3 to 6 months. Change the button type of tube every 3 to 6 months or sooner if it fails. The two most common things that fail are the valve or the balloon. The valve has an anti-reflux device to stop fluids from coming out of the stomach when putting on or taking off the extension set. It is common to see a few drops of formula or stomach juices come out of the valve. However, if you do see it pour out of the valve, then it is broken and the tube should be changed. The balloon can develop a small leak or it may break. If this happens, you may notice some leaking at the site. It is okay to check the balloon if you see leaking. There is no need to routinely check the balloon. If the tube falls out by accident, test the balloon when the tube is out of the tract. Fill up the balloon with the correct amount of water and look for a leak. If it is broken, change the tube using a spare new tube kit. If the balloon is not broken, it is okay to replace the tube using the same type of tube that accidentally fell out. As your child grows, the tube size will need to be changed to a longer length. If you see the tube fitting too snug or too tight, tell your doctor or nurse so they can change the tube to a longer length. When the tube becomes too tight, you may have a harder time spinning the tube, or you may see red marks under the skin where the tube rests. It is best to change the tube on an empty stomach. I recommend changing the tube just before a feed is due, or if the feedings are continuous, turn off the pump for 1 hour before changing it. Now let's walk through the steps on changing a G-tube button. First, gather your supplies. The G-tube kit has all the supplies except a washcloth, gauze, bottled water, and sometimes the kits may not have lubricant. Here is what you will all need. The spare tube. Verify that the size of the new tube matches the size of the tube in your child. Lubricant. Do not use Vaseline or petroleum jelly. 2 slip-tip syringes, 1 to remove the water from the old balloon, and 1 to add water to the new balloon. The size of the syringes will depend on the size of tube. Bottled water. Saline water or sterile water. Do not use tap water. You'll need an extension set, gauze or washcloth. Before you change the tube, wash your hands and make sure all the supplies are ready to be used. Tell your child what you are doing to help them relax, using distractions such as toys or a TV show. This is all helpful too. Fill up the syringe with the correct amount of bottled water. Depending upon the type of tube will depend on how much water goes into the balloon. Some tubes have the volume of water written on the balloon port. Insert the recommended volume of water into the balloon to check for leaking. If the balloon looks all right, remove the water back into the syringe and set the syringe of water aside. Lubricate the end of the new G-tube. Have your child lay down in a flat position. After you have all your supplies next to you, remove the water from the balloon of the G-tube in your child. Place the empty syringe into the balloon port and pull back all the water from the balloon. Be sure you have a gauze or a washcloth to soak up anything in the stomach. Remove the old tube by gently pulling up using slow, steady pressure. Quickly place the gauze or a washcloth over the hole. Take the newly lubricated tube and place it in the hole, gently yet firmly. If meeting too much resistance, try pushing a little firmer or relaxing techniques if your child is too tense or crying. You could also place lubricant over the stoma, or the hole, as well as the end of the tube. Hold the button tube in place while attaching the syringe with water into the balloon port. Push the plunger to allow the water into the balloon, and then remove syringe while keeping a little force on the plunger to prevent backflow into the syringe. Never fill the balloon more than the maximum volume allowed. Gently pull up on the tube and spin to make sure the balloon is filled and in proper position. Stop when you feel resistance. Wipe away any extra lubricant around the G-tube site. Attach the extension set by holding onto the device firmly. Attach an empty syringe and pull back. You should see some stomach juices. Remove the extension set if feedings are not being given at this time. Place a dressing if needed. Praise your child. Clean up and wash your hands. Remember to call your home supply company after each tube change so they send a new spare tube to the home. If you are ever in a situation where you are not able to replace the tube, be sure to call your nurse or doctor right away. If you are not able to get a hold of your nurse or doctor within 1 hour, bring your child to the emergency room. Make sure to have the size and name of your tube with you, as well as one feeding extension set. Thank you for watching.